Okay, thank you very much for joining us. We have in the studio Mr. Charlseoloriegbe, HOD, College of Nursing Science, Edo State. So, sir, introduce yourself.
Thank you for having me on the program. I'm Charlseoloriegbe, as I just said. I'm the head of the Department of Nursing at the College of Nursing Sciences University. I'm talking about the nurse and nursing as a profession. Who is a nurse? A nurse is a trained member of a healthcare team occupying a very critical position as one of the largest number of caregivers in the health sector. And what do they do? What does a nurse do? The functions or the roles of the nurse are numerous. However, I will break it down for easy understanding. The nurse that we see manipulates the environment, physical disposition, and other exogenous variables to ensure the comfort of a sick person. The functions of the nurse actually goes beyond taking care of a sick person, because the nurse also works in the community, rendering community service through health education, counseling, and health promotion. The nurse is also a client advocate, ensuring that the client under her care is well protected from harm and exploitation. This is what we normally refer to as principles of non-malfeasance. The nurse also ensures that the patient gains in all its ramifications during their interactions. When you are interacting with your patient, the patient should gain. There must be benefits, and that is what is called the principles of benevolence. As a nurse, the major purpose, especially if you are working in a healthcare facility, is to ensure that a patient gets well and goes back home early, because long-term stay in hospital has a lot of burden, both financial, social, and psychological. So by the time you take adequate care of this patient and we are discharged early, you have done a great deal of job. Then apart from that, as a nurse, you realize that you have to carry out a lot of functions that will ensure that the patient either gets well. If the patient does not get well, you will also have to ensure that you make the patient who is not going to get well die peacefully. Because we cannot shy away from death. Death will come. When it becomes inevitable, the nurse will ensure that that patient dies peacefully. I will give you an example. If a patient is a cancer patient, maybe a terminal stage of cancer, and this patient is going to die, we know that the patient will not survive. And we know that there are drugs that you give to a patient with cancer to relieve pain, to alleviate his pain, because cancer brings about painful situations. And of course, when the patient has this pain, he demands for this kind of analgesic, known as narcotic analgesics. But some persons will tell you, if you give narcotic analgesic to a patient, he gets addicted to it. But for a patient with cancer that is going to die, you will have to continue to give this narcotic analgesic so that the patient does not feel pain. Patient's pain is alleviated and he dies peacefully. So that peaceful death, caring for the patient, dating the patient, whatever you do to ensure comfort of the patient before he dies is also a function of the nurse. So there are two ways to do it. You care for the patient to get well and go back home, or you care for the patient to die peacefully. The nurse also, all these are as a result of scientific preparation through polyvalent training, position to practice in any part of the world. The training of the nurse is very complete and very, very polyvalent. Well, what we mean by polyvalent is that there are a lot of aspects in the training of a nurse, a lot. By the time you go to a typical training institution and you really see their curriculum, you know that it is jam-packed. It is highly studied. Pharmacology, psychology, sociology, apart from the nursing itself. And of course, they have a lot of practical sessions. They go for community training, public health training. They also go for psychiatric training and so many other trainings that they do. So all this one put together is what is known as equivalent training. Our emphasis in this paradigm shift in global outlook is to ensure that any nurse that is trained as a polyvalent nurse can practice in part of the world. And that is what we mean by global. So that is why some of the nurses in Nigeria have migrated abroad and are doing very well. I will talk about the migration of nurses later. But I want to continue by looking at how to become a registered nurse. To become a registered nurse, of course, like I said before, there are training institutions spread all over Nigeria. The training of nurses in Nigeria as of now are two-phase training, double phase. One is the diploma training. The second one is the bachelor's of nursing science degree training. The diploma training is carried out in our normal schools of nursing. There they spend 3 years, and of course they write their final qualifying exam, the registered exam, and at the end of it, they register to practice as nurses. Then the second one, the degree, is done in the university. But let me first of all emphasize that both trainings are regulated by a regulatory body known as the Nursing and Midwifery Council of Nigeria. The Nursing and Midwifery Council of Nigeria is a regulatory body that is charged with the responsibility of ensuring that the normal standard of teaching is carried out in any training institution, and the normal standard of practice is carried out in our health facilities. So they are both ways. So they regulate the practice, they also regulate the education of the will-be nurses. And like I said before, the training institutions will be accredited by the Nursing and Midwifery Council. The accreditation is one, looking at the facilities on ground, and two, looking at the personnel. For you to be qualified to teach in the School of Nursing, you must be a registered nurse educator. Apart from that, there are other ancillary trainers that you find in a typical School of Nursing. Even pharmacists, medical doctors, and other professionals have their own place in the training of the students that we have in our training institutions. And of course, for the degree that takes place in the university will have a department of nursing, and of course, the students who are there will spend 5 years training to obtain the registered nurse certificate, the registered midwifery certificate, the public health nursing certificate, and the bachelor's of nursing science degree certificate. 4 certificates is what they obtain at that level. So it is a higher level of training, that is the BNS. After that, those that went to schools of nursing who have the ROI can go back to the university to spend some time together. I mean, for now, the number of years they spend is 4 years. 4 years. But we are thinking that the number of years are actually too many for now. Because you have spent 3 years in your diploma school, and you are coming back again to the university, you are spending 4 years. We are thinking that it should not be more than 3 years maximum. But however, the authority that is charged with that responsibility is looking at that proposal to see what they can do to reduce the number of years that registered nurses spend in the university. I want to say here that those with degrees in nursing have better prospects, because at that point they can go for their masters, MSc nursing, they can also go for their PhD, and in that case they have a broader scope of areas that they can work in NGOs, some can work in international organizations, apart from lecturing in the university or lecturing in other health institutions, because the opportunities they have are obviously more than the opportunities the people nurses have. Then, of course, there's another area that I want to look at, that is practicing outside the country.
I have a question.
Okay.
What are the opportunities for diploma nurses?
The opportunities for them is working in either government or private facilities, health institutions. You know, some of them can also migrate. They can also migrate.
And the licenses?
Yes, of course. It's the same license, it's the same registered nurse license. The only thing is that for the degree holder, they are better placed. They have a higher pedestal of placement than those that have a diploma. Yes.
Where does this auxiliary nurse come in?
I will talk about that on that one.
Okay.
Yes. Then practicing outside the country. The new trend now is migration of nurses to the outside world. UK, America, Canada, and even the Middle East. Some nurses have gone to Saudi Arabia, some in South Africa. And so the level of migration of nurses in Nigeria today is very high. Last year alone, we were told that over 7,000 nurses migrated from Nigeria to the foreign countries to practice. The step-by-step process of migrating, for a nurse to migrate, first of all, that nurse must be a registered nurse with Nursing and Midwifery Council of Nigeria, and his license must be valid. Licensure by Nursing and Midwifery Council of Nigeria ensure that you are licensed and your license will expire after 3 years, which will be valid for 3 years. So after the 3 years, your license will expire, you renew it. So for you to migrate, you must, if your license has expired, you must renew it. So your license must be valid. That's number one. Number two, you must have an international passport. Because most of the exams you are going to be writing, you will need the biometric page, the page where you have your biometric data. That is what you will use for the exam. And so you must have an international passport. So any nurse that does not have an international passport is not ready to migrate. But if you are ready to migrate, one, your license must be valid. Two, you must have an international passport, valid international passport. Then you will write the test of English exam, the one that is called IELTS. So you must write that exam and score the requisite band. It's the requisite band, maybe band 7, band 8, whichever band put together, because there are different sections in the exam. You must meet the requirements for that. You must pass, and of course, you will write after passing that English exam. You will also pass the CBT exam for nurses, specially made for nurses. The CBT is computer-based test. So, and it has to do with nursing questions. So by the time you are able to pass the 2 exams, then you are now ready to commence the process of migration. So first of all, when you pass these 2 exams, you apply to Nursing and Midwifery Council of Nigeria for verification of your certificates and your license. So when you verify, it's a way of bringing the NFC of UK together with Nursing and Midwifery Council of Nigeria. So the verification is to tell Nursing Council of United Kingdom that this person is a nurse. That is the verification. So the verification thing and all the documents are sent to Nursing and Midwifery, to NMC in UK. So they will now give you a pin. They will give you a pin. Then you will use that pin to begin to apply for job placement. Because as at that time, you've already, there are fees you will pay anyway when the process is on. You will pay some in pounds, you you pay some in naira. The one you are paying for non-sanitary council is very in naira. It's about 70,000 naira. But the one you are paying for NSC UK is about 140 pounds. So the two bodies will work in synergy to ensure that the person that is coming, that is migrating, is actually a nurse. So once that is done, you get a PIN. They give you a password. NSC UK will give you a password. So you will use that password to begin to look for job placement. There are two areas in job placement in the UK. You have the HNS or NHIS. They call it National Health Insurance Scheme. That is one aspect. The NHIS are responsible for placement of persons in health facilities that render clinical services to patients, just like normal patient care. Patients come just like the one we have here. So they come, patients come in, they are cared for, and they go back. That is for NHIS. There are so many facilities that are under NHIS. So if any nurse is migrating, you will apply through NHIS. So it's NHIS that will now conduct interview online for the nurse. So if you are qualified, they will send a message to you that, oh, following your interview or so, we're happy to inform you that, oh, you have passed the interview, and this facility, they will look for a facility that will hire your services. So they will liaise with that facility, and the facility will take you over, and of course you are given a certificate of sponsorship. They call it COS. They will give you an offer of appointment and send a certificate of sponsorship to you. So it is with that certificate of sponsorship and your offer of appointment that you will now take to the embassy to apply for visa. So visa application becomes very easy for you with those documents. You don't even need to have a gun in your account because they've already given you a certificate of sponsorship. They have already accepted that they're going to sponsor you. In fact, they have given you a job offer. And so you don't need to have money in your account. So as soon as you get there, sometimes some of them even pay for your airfare. They will pay for your airfare. They send an air ticket to you. You go over there, they put you in the hotel. They will come and pick you at the airport and put you in the hotel for 1 month and pay you some handsome money with which you can settle down. They will give you the money with which you apply for your visa. They will refund it back to you. If you are not giving air ticket, they will give you 800 pounds for your air ticket. Then they will give you other allowances that will keep you going. So it's actually a very fantastic offer. So the second one is the one that is home care. Home care has to do with care for the elderly. You are caring for elderly ones that are maybe retirees that they have one or two incapacitation, like maybe they have arthritis, they can't move, just old age conditions. So those ones are in care homes. They're not really hospitals or health facilities. They're in care homes. Abroad, you have a lot of facilities that take care of the elderly ones, not necessarily the hospital. So this one, you can have a whole, maybe about 10 flats where it's like old people's home. So the nurses that are working there are home care nurses. They are known as home care nurses. They are quite different from other nurses in normal health facilities. So they go there, they care for them. Some of them who cannot even walk, they give them their bath, treat them, massage their joints. Those of them that have arthritis and all of that. So they assist them in doing so many things. So that is home care. For home care, I must say that home care, the pay for home care is higher than the one for NHIS. NHIS is 12 pounds per hour, whereas home care is 14 pounds per hour. So if a nurse migrates from Nigeria, that nurse is not a full-fledged nurse, it's seen as a student. The nurse will have to undergo some training and do an OSCE exam. So by the time you do your OSCE exam, then you are now a full-fledged nurse. You are given a PIN and you are now registered with NSC. UK. But before then, you'll be doing the training at the same time you treat your patients while they are paying you. So it's like a student that is being paid. So for home care, it's £14 per hour for 36 hours a week. For NHIS, for other health facilities, it's £12 per hour for 36 hours. So most people would prefer to go for home care. But some persons will tell you, in home care, you don't have enough opportunities for further trainings. Yes. But if you are in normal NHS facility, there are so many trainings that you can undergo. So those ones have better outlook than the other ones. So the nurses will go, by the time you have been able to register under NMC, and you have passed through all these hospital formalities, you have passed the hospital, then you can now work in any of the facilities and in any city. Because at the initial time that you must remain in the facility that hired you to do the hospital. So by the time you finish with them, then you can now go. If there is anything you need to pay, then the facility that is hiring you will now pay on your behalf. Either you remain in that city or you move to another city. So the nurse, the migrants, the nurses who have migrated abroad, very to UK, are very mobile. They move from one location to another, looking for greener pastures. So they are anyone that is convenient for them. Then, lastly, I want to talk on quackery. Quackery is a sore issue in the healthcare system. You know, we have a lot of professionals working in our healthcare system. Pharmacists, nurses, doctors, physiotherapists, nutritionists, radiographers, so many. And all of them are having this quackery problem. Even the pharmacists, we agree with me that there are quack pharmacists. They call themselves pharmacists, but they are not really pharmacists. So when you do what you are not supposed to do, as a professional, you are not a professional. You are only ascribing yourself to that belong to that profession. That person is a quack. So that takes me to the issue of quackery in nursing. We hear of auxiliary nurses. And I always tell people there's nothing like auxiliary nurses. The people that are called auxiliary nurses are actually quacks. They are supposed to be called quack nurses, not auxiliary nurses. Calling them auxiliary nurses means that they are being put in a particular position. The auxiliary nurses we see have not been trained. They have not been trained through no formal training. Some of them will just have secondary school girls who put them in one health facility, especially private health facilities. They are the ones that actually use them. They train them, they tell them, okay, we train you in the art of caring for patients, giving injection, doing dressing and all of that. But they're not nurses. And I want to emphasize that here, anyone practicing the art of nursing without requisite training from an accredited institution and license to practice. Licensure is very important. If they strip into a clinic, for example, a health facility, and they ask the nurses there to submit their licenses, if there's anyone that does not have a license required, and that person can be litigated. So I want to say that if there's any institution that is not accredited, it's not an accredited institution, and the products there are not licensed to practice by the Nursing and Midwifery Council of Nigeria, which is the supervisory authority for training and practice, that person is a quack, and that institution can be closed down by the government. And if such a person is caught, together with the health facility, that quack and the health facility are vicariously liable, and they stand to be sanctioned by the appropriate authority. We know that quackery is very serious, and it's an easy really, because many people have died on the hands of quacks. unknowingly, because everybody will just think that whoever is putting on white and a cap in health facilities is a nurse. You just assume. You can imagine leaving yourself for somebody who does not have any knowledge of care to start taking care of you or giving you injection. Some people have been paralyzed. Some people have been. Some people have even died in the course of having that kind of interaction with this class. And of course, it is not anybody with nurses uniform parading herself as a nurse that's actually a nurse. Such a person is a burden and a risk factor on innocent Nigerians. We should therefore be very careful with those that we entrust our care to, because our care is our life is very important to us. And if we allow ourselves to be manipulated or to be worked upon by people who are not qualified, then we are taking a very big risk. So I want to urge my listener to be sure in any facility they get to, they should find out whoever wants to take care of them, they should find out if the person is qualified to do that. They should not entrust their care into the hands of those that are not qualified to do it. Otherwise, we'll be saying that somebody who is a nurse is wasting his time going into an institution of nursing training. Or then you could as well just take your daughter who wants to become a nurse, take him to one of the health facilities to go and learn quackery, or to go and learn auxiliary nurses that they normally come. Because there is nothing like auxiliary as far as I'm concerned. They are quacks, and if they are caught, they are sanctioned.
Okay, the nursing council does not recognize them
at all, because they are not licensed. The nursing council, let me tell you how a typical nurse is licensed. You go to a training institution, you spend 3 years. Let me use that of 3 years. You spend 3 years. At the end of your 3 years, it is the nursing council that will conduct exam for you. It's a national exam. For all the schools of nursing in Nigeria, they will conduct a national exam, which you must pass. If you pass the exam, then you are licensed to practice. So once you have been licensed, then you are free to go and practice as a nurse. But that license will only be valid for 3 years. After that, you renew your license. And if you renew your license, you must undergo training, what is called MCPDP, Mandatory Continuous Development Program. You must be doing to be seen, you must be seen to be, improving on your knowledge. And in doing that, you will be given certificates. And you are allowed to be involved in 3 training programs. So you use the 3 certificates to renew your license. So in 3 years, where your license is valid, you must be undergoing training. So after the license has expired, you will use the 3 years training, or you will use the 3 training certificates to renew your license. So it's something that is well regulated. So if anybody comes out to say, "Oh, I'm a nurse," and it's not undergoing through all these processes, then the person is important, and we won't be able to practice the way others are practicing. That is how it is. Yes.
Okay, so before we go, I don't know if you can share with us any of your experience.
Yes.
As a practicing.
Actually, I did not practice for a long time. When I flew from the school of nursing, which I attended, I worked for just 1 year after my licensure. So I worked for 1 year and went back to the university, where I did my bachelor's degree program. So immediately after my youth service, after the degree program, I registered as a nurse educator and started training nurses. So I've been training nurses since then till now. So my experience is just in the school area. So I've been in the school area training nurses. But one good thing with it is that as a trainee or a trainer of nurses, we have a lot of opportunities for advancement, for growth, than those in the practice area. Those in the school area are very mobile. The jobs are there. They are seen to be, they are needed everywhere. because more schools are springing up and very few people in the school area, more people in the service area. So my experience is that I've been involved in the training of nurses at both the School of Nursing and in the university. I worked as a nurse educator, rising to the position of the principal of the School of Nursing. After my disengagement as principal of the School of Nursing, I joined the university to lecture in the Department of Nursing for 3 years. And I'm here now in the College of Nursing Sciences as a. So you can see that we are more needed than those in the service area. But those in the service area can remain and decide to establish their own facility, nursing homes, and continue from there. And of course, they can make a breakthrough if they are serious about it.
I have a question. You mentioned nursing homes.
Yes.
How do they go about? Is it licensed?
Yes. Nursing homes. If you want to open a nursing home, you go to the Ministry of Health. It's regulated by the Ministry of Department of Nursing. The Director of Nursing Services will give you a form. You fill the form. There are certain formalities you have to be licensed as a nurse and all of that. You must be sure that you are a nurse for you to open nursing. But you have to go to the Ministry of Health where you have to commence the process until it is approved. They will come and look at the facility that you have, all the things you have there. They will not just approve nursing home for you. They must come and see the facility and what you have, all the things you have there that you're going to use. So once they are satisfied, they will approve the nursing home for you.
Is nursing home the same thing with those maternity ward?
Okay, fine. There are two. You have maternity homes and nursing homes. Okay. Maternity homes are where you take care of pregnant women, where you can also take delivery when they are in labor, where you can take care of the babies after delivery. So it's a whole complement of the woman during pregnancy, then during labor, and delivery. So both antenatal and postnatal care is what you can carry out in the maternity home. We also give immunizations and all of that. But for nursing home is actually care of a sick person, not necessarily somebody who is pregnant. Sometimes they can even recuperate. Patients can recuperate in a nursing home. Let me give you an example. A patient that when they have undergone surgery in a health facility, maybe that health facility is owned by a surgeon. That surgery is done. That patient can be transferred to the nursing home. Yes, for post-operative management, post-operative nursing management. So the doctor does not need to have that patient in his ward. It's always okay. I do your surgery. You go to a nursing home and recuperate. From there, you are discharged home. Those are the things they do, and it's a whole lot of things. They can also do immunization. Most of these things. So the nursing home and the maternity home are areas that either the midwives or the nurses can delve into. Of course, most nursing homes you see, they are owned by those that who have worked for a very long time. Yes, and they are running them very well without very much. Yes.
So finally we're about to go now. I don't know if you have a final comment for us.
Yes, I want to say that nursing is a very good profession that people should encourage their children to go into. I am a living witness to this nursing profession of the thing that we're talking about. I want to say that my younger brother is a nurse and is in the US practicing. He was a lecturer in the Unity School of Nursing before he went abroad. My son is also a nurse. He graduated from the and he went back to do nursing. Presently,
which course did you study first?
He read soil science.
Okay, and then went back to nursing.
And right now, as I speak, he's in the UK practicing, and I think he's doing well. So we can always encourage our children to go into nursing because one, apart from the fact that they will be useful to the immediate family, job offers may not be too difficult for them. In these days of no jobs here and there, they can stay on their own. They don't even need to move to migrate. They can stay in Nigeria and still do very well, and be useful to themselves and the family and the society in general. So I want to say that nursing is good. The misconception that people have about nursing and nurses is not really true. That is why we call it misconceptions. The nursing profession is a noble one, and we can always encourage our children to go into it, and we make very good use of it, and we will all be better for it. Thank you very much.
Thank you very much for your time, sir.